This is an arthroscopic suprapectoral biceps tenodesis using a transosseous technique, which is implant-free. The standard portals are used with an anterolateral portal and a mid-lateral portal for arthroscopic viewing. The biceps tendon sheath is released and the anterior subacromial bursa is resected. The arm is forward flexed to improve viewing. A posterior grasper is placed. The biceps tendon is grasped and brought out to physiologic length-tension relationship in the subacromial space. A 2.9 millimeter awl is introduced through the antero-inferior portal, and two medial awl holes are created in the robust bone of the intertubercular groove. Here the second, more superior medial tunnel is created at the same time. The transosseous tunneler is introduced through the anterolateral portal and is placed in the medial tunnel. It is advantageous to internally rotate the arm during this maneuver. Here a true transosseous hybrid technique has been utilized, and the tunneling device is being used to work in close proximity to a previously placed anchor. There's no motorized drill here, and the awl is used to scythe past the anchor and target effectively into the medial tunnel, as shown here. An antero-inferior accessory portal is created with a spinal needle, and a retrograde suture passer is placed through this portal to grasp the doubled suture loop. A locking loop method, which has been previously described, is then utilized, grasping the lateral limbs of the previously placed suture, retrieving them from the antero-inferior portal, and then back through the low anterolateral portal for tying with a knot laterally in the suprapectoral location. The superior transosseous tunnel is then created, interlocking with sutures previously placed for a cuff repair. The loop is maintained medially, as shown previously, and the retrograde suture passer is brought in through the accessory antero-inferior portal, retrieving the loop through the tendon. At this stage, a grasping device is brought back through the antero-lateral portal and used to grasp the proximal portion of the biceps tendon in the subacromial space. The posterior grasper is then used to bring the more lateral suture of the loop over the biceps tendon, creating a cerclaged suture effect around the tendon, similar to a whip stitch for open surgery. Pulling on the inferior tails will then bring the suture back into position, creating a cerclaged arthroscopic biceps tenodesis. Once again, the retrograde retrieving device is brought back through the suture loop, creating a locking loop, and in this case a double locking loop is constructed, bringing the suture back through the accessory antero-inferior portal. The sutures are then retrieved and the knots are tied laterally. Known as the final construct with the biceps tenodesed anteriorly in a suprapectoral arthroscopic transosseous technique, which is implant-free.